Want to show you these pictures coming in from China. The construction of a hospital to deal with coronavirus patients exclusively. This time-lapse video, it's just amazing. 8 days is all it took to build this hospital, and one of the hospitals is actually admitting patients as of today. Just 8 days later, there's a second hospital as well, not quite finished, but they're going to have two to deal with the thousands of coronavirus patients, which is really good news because what we're seeing now increasingly and hearing pictures and accounts of what's going on in the hospitals, a need for masks and protective suits, safety goggles, all sorts of protective medical equipment. We're hearing as well today from the state news agency in China that 68 medical teams, 8,300 staff from all across China have been sent into Hubei to deal with the increasing outbreak in the province. And as I bring in Michael Serapio on all of this, they're trying to deal with it obviously themselves, Michael, but they've had to make what is quite a remarkable step of asking for international help as well.
Absolutely, and this happened this morning earlier at China time in Beijing, as the foreign ministry essentially said that they, a dual message saying that they have the tools to control this coronavirus, they believe, but they do need international help because they are running low on supplies. Medical masks, yes, but also medical goggles, as well as protective suits, antiviral wipes, chlorine. Now, part of the problem has to do with the Lunar New Year because the biggest holiday in China, that had many factories shutting down. Some of those factories are only getting back open to business now. And while Chinese officials say, for example, a factory can make some 20 million surgical masks a day, China is a country of nearly 1.5 billion people, and provinces like Hubei have made wearing a mask mandatory. People are also hoarding and stockpiling supplies, and it's not like hospitals can recycle equipment as they deal with each new patient. So that gives you an idea of why there is this shortage. So today, the foreign ministry says they are reaching out to Europe, they are reaching out to the United States, hoping to get medical supplies, also acknowledging the fact that they've also received donations already from South Korea, Japan, Kazakhstan, Hungary. But this is very much supplies needed as they try to contain this coronavirus. And in some hospitals, they've been using rain ponchos because so short of supplies they are to actually protect themselves, to get the protective gear they can to protect themselves and also stop the spread of the virus.
They can make 20 million a day, and it's still not enough. That's exactly a very impressive number. The Red Cross, Michael, operating in Wuhan, I understand, receiving some criticism for not getting those medical supplies to the people who need it most urgently.
Absolutely, and this is something that has been shared on social media, now making its way to the greater press in China. And we have to say the Red Cross is one of 5 charities that has been designated in Wuhan to essentially redistribute the donations of medical supplies and money they're getting from across the People's Republic as well as around the world. But if you take, for example, the example of surgical masks, once again, the vice governor of Hubei province says that the Red Cross has received some 9,000 boxes of surgical masks, but have only distributed, according to the China Daily News, 3,000 masks to the Union Hospital in Wuhan. Now, this has led to accusations of incompetence and corruption. This extends to other donations of medical supplies and money. So hospitals are now bypassing the Red Cross. They are asking for direct donations from people in China and from around the world. The charity says it is now looking into what it calls internal issues, but in a country that's very scared about the spread of this coronavirus and about more deaths happening, certainly the Red Cross coming under fire right now for being incapable of responding to the crisis on the ground, Heather.
Michael, thank you very much.
You're welcome.